So today, what we're going to discuss is knee pain, and not necessarily what you've got, but what can go wrong and how we can try to avoid developing this problem before it require some kind of further treatment. Okay, and like Desmond mentioned, with the circuit breaker going in and most people working from home, there's actually a lot more time and lot more opportunity for us to actually get fit and start exercising again. So my background, I work for a sports and orthopedic clinic based in Gleneagles Hospital. I tend to do a lot more sports related injuries. I do a lot of shoulders, elbows, hips, and knees as well. The sports and orthopedic clinic is actually part of the shoulder elbow orthopedic group. These are my three partners in. These are the three partners in crime, or rather, three partners in providing medical excellence to you. You know, we're all trained in the dark arts of shoulder and elbow surgery, which is why the group is a shoulder elbow orthopedic group. Because I'm sure you're well aware, the shoulder is a very complex joint, and it takes a very specialized training to actually be very good at it. So all three of us, we work for the shoulder orthopedic group. My clinic also deals a lot of hip and knee injuries as well, as with particular emphasis on sports injuries and sports-related exercise medicine. So that's why it's sports in orthopedic clinic. All right. So let's just move on. So now that the government has come up with this circuit breaker, social distancing thing, a lot of people have more time to exercise. You're staying home more. There's no gym access. You can't get out into the common exercise facilities down by the at the bottom of our estate. You know, we can't get to the swimming pools. We can't get to the tracks to run anymore. So a lot more people are actually exercising at home, right? Because if you have to wear a mask and run outside, it's just, you know, exercise outside, it's just too uncomfortable, especially in the last few days where it's been so hot. Increasingly, more and more people are running and cycling. You know, suddenly once the circuit breaker has been put in place, everybody is a champion runner and cyclist. There are a lot more people on the park connectors, in the end parks, exercise areas. So all this has to be good, right? I mean, we're all exercising a lot more, but ironically, it doesn't always mean we will always get fitter. There's also more exposure to injuries. So if we're going to do a lot more exercise, we're going to higher risk of developing injuries, especially if we haven't exercised for a long time and we're starting to exercise again. Okay, and you know, as we go full steam ahead with work in the normal day-to-day grind of normal pre-circuit breaker life, you know, most of us don't have very much time to exercise. And now suddenly we're trying to exercise twice a week, 3 times a week, every day in a week. So it's very possible that our body is not conditioned enough to actually tolerate this kind of sudden increase in physical activities. Okay, so very broadly speaking, there are 2 main things that we're looking at. One is knee pain, which is just pain when you start doing certain exercise activities like running, stair climbing, cycling, HIIT, things like Tabata as well, which is very popular now when you log into YouTube and do all these online exercise programs. You can also get knee injuries, and this happens when you fall or you twist your knee when you jump and land, especially with HIIT and Tabata. And you know, with falls, if we're out on the road cycling, even though there are much fewer cars on the road now, you know, it still increases the chance of us slipping on the road, slipping off our bikes, slipping off the trail in Bukit Timah Hill, for example. And we can actually fall over and hurt ourselves if you're not too careful or we're not too accustomed and doing these activities. Okay, so what we're going to talk about next is what's in the knee, what can get damaged, and how are we going to avoid this. So this is the front view of a right knee. Okay, very importantly, I'm just going to identify a few things. That's the thigh bone on top, if you all can see where my laser pointer is, and that's the knee bone at the bottom, the shin bone at the bottom. This shiny white, bluish white thing is cartilage. It's not really blue in the knee, but it's just in this picture. And this is the smooth, firm covering at the end of the joint, which allows the joint to move smoothly over each other so that you don't have bone rubbing on bone and you don't get pain and stiffness from that. Okay, so it's very important that you have good cartilage in the knee, you have good strong support the joint. And down here, this white band is actually a shock absorber. This is what we call a meniscus. Each knee has 2 meniscus, one on this side and one on the other side, and basically it's like a cushion that absorbs the shock from your body that's landing through the thigh bone onto the shin bone. So every time you jump and you land, there's a little cushion there which prevents this bone on the top from hammering right into the bottom bone. So if you didn't have this shock absorber, or if this shock absorber was spoiled or not working, then you can imagine that this bone on top is just like a hammer. It's just going to hit the bottom bone and you're going to crack the cartilage at the bottom. You're going to crack the bone at the bottom. You're going to end up with pain in the joint. Your joint's going to wear out. And that's a big problem. Okay. And the last important thing, of course, is what binds the knee together. And those are the ligaments. So there's ligaments on the side here. There are also ligaments in the middle that prevent your knee from twisting out. So quite commonly with certain injuries, when you jump and land or you twist your knee, you can actually tear one of these ligaments, and that can give instability in your knee. Okay, so what are the reasons for knee injuries? Basically, like I mentioned earlier, once we were sedentary, doing mainly office-based hours, not much time to do work. By the time you get home, you got to settle the kids at home, you got to settle the house, you got other things to do, and suddenly now you're all getting active again. Okay, and the body is a wonderful thing. The body adapts to what activities you're doing. So if you've been exercising a lot, your body will be very strong because it has to be able to take the impact of jumping and running and cycling. But if you've just basically been sitting in the office 5 days a week pretty much and not exercising very much apart from that, then we basically become like a jelly. Our bones will get softer because all your bones and your muscles need to do is just basically allow you to sit in your chair, right? So it's the same thing happens when you go up to outer space and all those astronauts going to the International Space Station. Because there's no gravity there, there's no work to do. There's no work for the muscles to do. And if they stay there for months on end without doing any kind of exercise, what happens is the bones get softer and softer and weaker. And then by the time they come back to Earth, they're just this blob of jelly that's just lying on the floor and too weak to move around, and the bones are weak. And if they fall over, it's quite likely they're going to break something. Which is why when they're up there, they actually have a very strict exercise program to stress the bones, to stress the muscles, to keep everything strong. Okay, so when we transition from our sedentary lifestyle to a more active lifestyle, we have to make sure that we give our body time to adapt and to grow and to strengthen in order to do these activities. Okay, so what are the reasons for developing these knee problems? So with knee pain, for example, when you do increased activity, but your bones and your cartilage cannot support the impact of running and jumping and landing, then you can actually crack the cartilage or even crack the bone in your knees. Likewise, your muscles and tendons and ligaments are not accustomed to the stretching and pulling and amount of strength that you need to do. You can actually get strained. You can actually tear the tendon and the ligaments and as well. Okay, so again, falls. Why are we falling? Because there's just more increased risk exposure. We're doing new activities because previously, we used to swim or we used to do something else. Now, suddenly we're taking the bicycle out of the shed or out of the car, the bike park downstairs. We're trying to go on the road. We're slipping on the road because it's very wet and rainy today. Or we suddenly decided I'm going to become a mountain biker. I'm going to ride on the mountain bike trails, and you hit a tree trunk and you're going to fall over. All right. Likewise, if you're doing exercises at home, all these exercise aerobic programs like HIIT or Tabata, if you're doing a lot of jumping and landing and star jumps and burpees and stuff like that, if you land badly, you can actually twist your knee. For example, if you look at my video here, that's a knee. So if you land badly and you twist it like that, you can strain this ligament. You twist it the other way, you can strain this ligament. You can twist it this way. And landing badly isn't just about jumping and landing. Landing properly does involve having good muscle control in your hip muscles, your back muscles, your thigh muscles, all these muscles which you haven't used for many months. Okay, so it's important that we are all conditioned, the body is all conditioned to do these activities. And I'm not saying that we shouldn't do these activities, we should just take it slow and build it up from there. Okay, and you can also get twisting injuries from inappropriate footwear, equipment, okay, and not taking care of what's around the house and what's around us when we're actually doing these exercises. Okay, so again, what can you injure when you fall? You can obviously fracture something or break something. You can just bruise your bones and muscles, and this will take time for us to recover. Likewise, with twisting injuries, we can tear the ligaments, tear the meniscus, tear our muscles. We don't want to do that because by the time you recover, which is 6 weeks, 2 months later, the whole circuit breaker period will be over. Okay, so now that we know what can go wrong, what do we do? Okay, so the important thing is you must always remember that prevention is better than cure. You don't want to have to see a doctor. You don't want to have to activate your insurance plan. Okay, so just remember prevention is better than cure. Okay, so like I said just now, number one rule, just go slow. If you're starting to run again and you haven't run in many years, don't expect to pick up where you left off 10 years ago when you could do your 2.4 in under 10 minutes, or you can run 4 kilometers in 20 minutes or something like that. Okay, so start slow. Your heart may be able to take it, but your joints, your knee, your bones, your muscles may not be able to take it. So start slow, run a short distance, 10 minutes, 15 minutes, or 1 kilometer, 2 kilometers. Take a break for 2 or 3 days, let your body recover from it. So there will be some minor wear and tear, some stress to your body when you start this, but you need your body to let itself heal before you load the next round of stress on the bones and the muscles and joints. Okay, so after that, if you find that, I can run 15 minutes once every 3 days and I'm not having any problems, then you slowly build up. You either increase the duration, increase the distance, or if you want to, you can increase the frequency. Instead of doing every 3 days, you can run every 2 days. And then you give your body some time to rest, see how you're feeling. If you're feeling very sore, take a day off, take a break. There's no reason to push yourself very hard. This is it's a journey, it's not a sprint, right? So we need to let our body grow as we get on this journey for fitness. Likewise, if you're doing weight and strength training exercises, you're doing squats and dips and all these things and carrying weights, our body and our muscles may have been deconditioned over the last couple of months, couple of years. So it's important that we start low. Don't go for heavy weights. Work on endurance first. So go for low weights and more repetition. So if you can do 2 to 5 kilos, for example, very comfortably, then just do 20 reps of those in 3 sets. So you do one set of 20 reps followed by another set and another set, just to get the body going, get the muscles going, and then slowly build up the weight that you carry, or decrease the number of reps that you're doing. So once your endurance is there, then you start working on the strength bit. And for strength training, you want to have more weight, more load. So do 5 to 8 to 10 kilos, depending on what your body can handle, and just do fewer reps. So, in some cases, you may even just be doing 8 reps to do a lot of strength training. But definitely don't go straight from 0 to 80% of your maximum load carrying capacity within 1 week or 2 weeks, because you're bound to hurt something. Now, the other popular thing is all these exercise programs that you can find on the internet, on the TV. Now, everybody's got a smart TV or subscription to an exercise program. It's great to watch all these people exercise. They're all so fit looking. We all want to look like them. We all want to be fit like them. The thing to remember is these guys do it for a living. They've been doing it for years and years and years, and they're very well conditioned to do this. That's their job. Okay, so my advice is, if you're watching one of these guys, just be a bit careful. You don't have to follow exactly what they're doing and to push yourself that hard right from the beginning. In fact, if you're searching the internet, what you should do is you should try to look for these programs where it's not just one guy doing it. There are a lot of these programs where there are 2 people or 3 people actually doing the same exercise. And what happens is one of these guys is usually doing a very light modification of the workout, and another one will be doing a medium one, and another guy will be doing a very high intensity workout. So if you're starting to do something like this, you probably want to follow the person who's doing the lightest workout. So instead of doing great high star jumps and things like that, you probably just want to be doing what the fitness demonstrator will be showing to you. So once you've done this once or twice and you find that, hey, my muscles can take it, my knees can take it, my fitness can take it, then you probably want to up the intensity and follow the next fitness instructor on the same video. Okay, so you're familiar with the exercises. It's not something new that you're doing, but you're increasing the intensity of the workout, and over the days and over the weeks, once your fitness builds up and your bones get stronger, you can start following the main instructor who's doing the high intensity workout, and you'll be panting away just like how he's panting away by the time he's done with his workouts. Okay, so remember, these guys look the part because they do the job all the time. They're very fit, and even they get tired doing these exercises. So we can't expect ourselves, who don't do this for a living and don't do this regularly, to suddenly become the greatest fitness guru out there. Okay, right. So warm-up exercises, okay? So every time you're going to start exercising, we need to warm up. Okay, don't confuse this with stretching. Okay, the idea of a warm-up is to get everything going. You know, it's like how when you start your motorcycle, you start your car, you need to get the engine warmed up so that you can respond to the road situation. So likewise, when we warm up, all we want to do is we want to get our heart going. Okay, so it's not, the heart's not sleeping, it's actually pumping and ready to exercise. We want to make sure our muscles have enough blood going in them, where there's enough flexibility for the muscle to start working. And we want all the joints to be a little bit supple so that we don't accidentally twist or pull something. Okay, so most warm-up exercises do involve a little bit of a stretching exercise, okay, which is just to loosen up the muscles, loosen up the joints, and it involves working certain groups of muscles. So if you're going to go for a run, you need to make sure your leg muscles are ready to go. So you may want to do a bit of squats, a bit of jumps, just to get the muscles firing before you get going. You know, if you're doing a lot of overhead activity, shoulder joint going. So the idea of a warm-up is exactly that. You want to warm up the part of your body that's going to be working out. Okay, because if you're not warmed up and the body suddenly has to go from 0 to 100, it's going to take a lot, and it may even predispose you to getting injured. Now, stretching is a totally different thing. Okay, and stretching is something that you want to do when you're cooling down. Okay, so stretching, there's something known as light stretching, which is what you do at the start of your workout, and there's proper stretching, which is basically trying to stretch all your joints and ligaments to get more flexibility. Okay, so if you're trying to get flexibility in your knee or your hamstrings or your quads or your arms or your back, you do that as a separate exercise, and you pull and you stretch out all the muscles. And the reason why you shouldn't do this kind of high intensity stretching before you exercise is because if you overstretch your muscles are now too stretched out and too loose. Instead of being nice and compact and ready to work, it's all stretched out and lazing and relaxing. You know, it's just like me lying in a recliner chair and I don't want to work anymore. So once the muscle is all too stretched out, what's going to happen is when you suddenly have to correct yourself from tripping and falling, the muscles aren't in a position that they can optimally work. And suddenly you find that the muscles can't work properly and you're going to fall over and you can hurt yourself that way. Okay, so don't overstretch during your warm-up. After your exercise, when you're cooling down, that's when you want to get all the muscles stretched out and relaxed. Okay, stretch your back, stretch your hamstrings, stretch your quads muscles. And this is so that you can recover more quickly, so that you're not so sore that day, you're not so sore the day after. You can get back to your exercise again. So one of the problems of not cooling down properly or not stretching properly after you exercise is you get a lot of soreness and muscle stiffness even the same day when you finish your exercise program, and that can affect your subsequent routine. Okay, equipment, very important, right? So if we've not been running for some time, then sometimes our shoes, you know, just left in the shoe cupboard can actually degrade. You know, the foam can powderize, or you know, if you've kept this same pair of running shoes for the last 5 years, and believe me, I've done that. Okay, because the shoe just looks too good. You know, the sole of the shoe looks good, the top of the shoe looks good. But the problem is if you are running a lot with these shoes previously, the sole becomes very stiff and hard. So it doesn't absorb as much shock as you would like to. So if you're running on the road, right, and every time your heel hits the ground, there's not enough shock absorption in the sole of the shoe, all this force, this impact is going to transmit through the shoe, through your heel, through your ankles, up into your knee, into your hip, into your spine, and you can get injured that way as well. Okay, so if you look at a professional, change their shoes no matter how good it looks, you know, every couple of months, because the important thing for them is that sole, that cushioning must be working. Okay, so if you want to wear these pair of shoes to the market, that's fine. But if you're going to be exercising in it, you got to make sure that the cushioning and everything in the shoe is still working fine. Okay, now if you're running on the road or on a track, get good running shoes. You know, if you're going to do a lot of trail running, you're going to the Bukit Timah Hill, for example, and you're going to be walking on uneven ground where there's muddy rocks and things like that, you need to get proper trail shoes. Okay, because what's different is the sole. The sole of the trail shoes is designed to have a lot more grip to hold on to the roots and to the rocks and to the mud. Whereas running shoes are flatter. They're just meant to hold on to the tarred road or the pavement that you're running on. Okay, so it's very important that you wear the correct kind of shoe for your activity. Otherwise, if you wear a running shoe onto a muddy trail, there's a high chance that you're going to fall over. Now, if hiking is your main thing, you're going to work on a lot of uneven ground, rocks, gravel, and things like that, then you actually want to have shoes that are built to support your ankle as well, so your shoe doesn't roll over. So high cut boots are actually more the appropriate footwear that you need for this kind of activity. Okay, I mean, it makes you look taller because the heel is higher as well, which is good, so you can see much better the scenery that you're looking at. But you want the support in the shoe so you don't fall over. Okay, so equipment is very important, especially shoes. Don't underestimate the importance of getting good shoes that are not old and worn out. Okay, now if running is your thing, just remember running surfaces do matter. Most of us in urban Singapore are running on the 5-foot way on the pavements or even on the roads. Now that most of the tracks in Singapore have been closed because all the fitness centers and sports facilities have been closed, we don't have the opportunity of the luxury of running on one of these softer tracks anymore. So the road or the tarmac or the pavement or the concrete is much harder than a soft cushion track, and it's definitely harder than a trail, which is soil and dirt and stuff like that. And what this means is when you run on the road, there's a lot more impact and lot more damage that's going to end up in your knees and your hips and your joints, and that can give you more wear and tear damage in these joints. Okay, and if you're running on softer things like track or trail running, usually the impact in the knee is not so bad, but you have a different set of problems, because if you're running on trail, the ground's usually uneven. There'll be roots, there'll be rocks and things like that. So you got to be a bit careful that you don't predispose yourself to some other kind of injury. Okay. Importantly, mix it up. Okay. If we are going to get fit, it's not all about muscle strengthening. It's not all about cardiovascular fitness, fitness of our heart, and it's not all about strength or stretching and flexibility either. We need all of these things, all three of these things to work together. We need the heart to keep us going, to keep up into our muscles. We need those muscles to be strong so that it can support our activities, so that it can support when we jump and when we land, and we can land properly without hurting ourselves. And of course, we need our joints and our body to be flexible, because if you're not flexible, you're going to twist something and you're going to damage something. So mix it up. So if you have to exercise every day, because we have time now, don't run every day of the week. Maybe you do running on Monday, strengthening on Tuesday, stretching on Wednesday, Thursday go back to a run again, Thursday go back to strengthening, Friday, and Saturday go back to stretching exercises, and Sunday take a break. Okay, or if you need to do something on Sunday, do a half version or a lighter version of it, so that you give yourself time to recover. You're not stressing the same part of your body every day of the week. So mix it up. It's good to vary the kind of exercise that your body has to go through, and it's also good because collectively all these bits come together to make a much improved version of you in terms of fitness. Okay, so mix it up. Very important. Now, if cycling is your thing, we've all got bicycles before. We bought from Giant or from Decathlon or from whichever shop that we normally buy our stuff from. If you've not used that bicycle for a long time, things might not be working. Some of the gears may be rusted. There might not be enough grease on the chains. Or worse still, if you've not inflated your wheels for a long time, the tires actually get deformed. The internal structure of the tire, the rubber gets deformed, and if you put that bike on the road, there's a good chance that you're going to have a malfunction of your wheels, your tires, and you're going to fall over. Okay, so make sure your wheels and tires are good. There's enough air in it. The threads, or like they say, the flour in your wheel is still there. So you don't slip and slide on the road and fall down. Okay, it's particularly important as well if you're riding on trails. Okay, and dry rubber can crack. Okay, so if you've not used this bicycle for a long time, don't bring it out to the trail or something like that on the very first time you're out. Otherwise, you're going to be stranded somewhere far away from your house with a bicycle and a broken wheel. Okay, now the professional cyclist will tell you that it's very important to get a bike that is appropriately fitted for you. Okay, whether the handlebars are too high or too low, whether the seat is too high or too low, whether the pedals in your gears are too narrow or too wide, far spaced out apart. Okay, whether your bike's too long for you. Okay, so I mean, for most of us who are just cycling for recreation, 15-20 minutes, half an hour, maybe it doesn't matter so much. Okay, but if you're going to do a 30-40 kilometer rides, okay, and you're going to be sitting on this bicycle for 3-4 hours, then you want the bike to fit you. Okay, because you want to make sure that you can sit comfortably on that bicycle without injuring yourself. Okay, so for example, if I've got a stiff back or my hamstrings are really tight, okay, I can't put a racing road bike in a very aggressive position because I can't bend and hold that position for a long time. I'll hurt my back, I'll hurt my hamstrings, I'll hurt something else. Okay, so for somebody that's the same size, same height, same length, same everything, but a lot more flexible in terms of his spine and his hamstrings, the bike fit for him will be a lot different. Okay, and you know, what's comfortable for him may not be comfortable for me. I may get injured if I ride on his bike. Okay, so if you find that you've brought your bike out of storage and you're on it and you're riding and you find that, you know, you're getting a bit of niggles and pains here and there, either shorten your bike ride, you know, don't go so fast, okay, because the bike may not be appropriately fitted for you, or get somebody to look at the bike, which is a bit difficult during this period, right? So it may be something that you want to do after the circuit breaker period if you still want to carry on with this hobby. Get somebody to look at your bike for you to adjust, you know, all the little fine details which will optimize your cycling posture, your cycling position, the power output you get, and the exercise that you get from this cycling activity. Okay, so don't disregard or belittle the importance of getting a proper fit for your bike. Okay, if you're not sure, read it up on the internet, see a professional. There are a lot of professional bike fitters out there that can give you the appropriate advice. Okay, exercising at home. This is the real in thing now, since we can't get out of the house. I mean, I really hate wearing a mask out of the house. The only reason why I'm sitting here without my mask on is because I'm alone by myself and I'm pretty sure my computer can't catch my virus. All right, so exercising at home is the in thing now. Most of us in Singapore, we don't wear shoes in the house. Okay, and you know, if we are doing exercise, HIIT, jumping, Tabata, we're doing a lot of all these exercises in the house. If you don't wear shoes in the house and you're doing all these activities, there's a good chance on your nice tiled floor or your marble floor, you're going to slip when you're sweating and the floor becomes slippery. You're going to slip and you're going to fall and twist your knee and hurt your knee. Okay, so you really need to make sure that your exercise space is set up so that you won't fall over and hurt yourself, so that the floor is an exercise mat is very important, and ideally wear footwear. Okay, wear shoes, don't wear flip-flops, don't wear slippers, don't go without shoes, because if you're doing a lot of running and jumping, every time you land, you're going to be landing in your heels and your feet. There's no shock absorption there. You may end up actually hurting yourself. Okay, so appropriate flooring, get a mat, a nice yoga mat if you have to. If you're doing a lot of jumping and things like that, you might want to get a nice thick one. Make sure you get good shoes or something that actually gives you some support, some cushioning as well, to make sure you don't fall over when you're doing these exercises at home. Okay, I mean, if you really don't like wearing a dirty pair of shoes in the house, I mean, I guess we just have to either get a new pair of shoes or get them nice and clean before we use it in the house. Okay, so take care of the environment around you. Make sure you don't get injured. Okay, and obviously don't do things that you've never done before. Okay, don't do high box jumps, for example, if you're not used to doing it, because this is going to from you if you don't jump high enough. Okay, so the guys who do this in the gyms and they look good doing it, you know, working on their leg strength and knee strength, they've been doing it for a long time, and they work their way up in terms of the different heights that they can jump. Okay, this doesn't just apply to box jumps. You know, it applies to any kind of exercise that you don't routinely do. Just because it's on Instagram or somebody's done it as some Facebook challenge or online challenge doesn't mean that it's a good idea. Okay, so be a bit discerning with what exercises you're going to trying to do. If you're trying to do something for the first time, make sure there's somebody around you just in case things go wrong. All right. Now, supplements, this is something that a lot of people ask, is there something we can take to try and protect our knees or help with our knees? Oftentimes people take things like glucosamine and all these joint supplements once they've got damage in the knee. Okay, so things like glucosamine you have been around a long time, 15 years, 20 years, and a lot of the early research seemed to suggest that it helps with the knee. I think increasingly most people have come to the realization that it does help with pain. Okay, things like glucosamine do help with pain, but only as much as taking Panadol or Nurofen would help your pain. Okay, so if you're expecting the glucosamine to grow back your cartilage and to grow back the damage in your joint, then that's not going to happen. Okay, so a lot of the supplements that are out there now tend to deal more with things like protecting your knee, okay? And this is not just taken by people who have knee problems, but people who are exercising a lot and want to prevent their knee from getting injured, okay? So things like this product called Synovial, for example, is an anti-inflammatory capsule, pill, or rather capsule, which has got a lot of anti-inflammatory traditional herbal things in there. It's got turmeric, it's got ginger, it's got winter cherry, ashwagandha, and all these traditional Ayurvedic herbs which have for long periods of time to reduce inflammation in the body. Okay, so again, this is not meant to cure your knee problem or to cure your cartilage damage or your torn meniscus or strained ligaments. It's actually meant to reduce inflammation, to try to reduce the amount of damage that is ongoing in your knee. Okay, now as far as cartilage is concerned, I mean, there a lot of supplements come and go. There's a lot of hype one year, and the next year it's not there anymore. One of the things that a lot of people are looking at now is collagen, or more specifically, undenatured type 2 collagen, which is also known as UC2. Okay, and why is that the case? Is because it seems that if you have ongoing wear and tear of your cartilage, if you have enough UC2, the rate of wear and tear of the cartilage seems to be much less. Okay, and again, you know, a lot of these tests are done on animal studies and things like that. So, is it directly translatable to? It's anybody's guess. Okay, but the early research seems to suggest that it can have some cartilage protective effect, especially if you're doing a lot of impact activities which may damage your cartilage. So if you want stronger cartilage and you want it to break down slower, you may want to consider something like undenatured collagen. Okay, and that's the stuff that you eat. It's not the stuff you apply on your face or on your knees. Okay, it's not going to work that way. Of course, the last thing is calcium and vitamin D. We've all heard about this. Everybody knows about calcium and osteoporosis. Okay, so like I said earlier, if your bones are weak and you're doing a lot of jumping or running or repetitive impact activities, you can actually crack the bone because the bone is just not strong enough to support that exercise. Okay, so calcium is important, but equally as important is vitamin D. A lot of people forget about vitamin D. Okay, vitamin D is an essential vitamin that allows your body to absorb calcium and to use calcium, not just for bones, but also for the muscle. You need vitamin D for good contraction of your muscle and good control of your muscle, okay? Now, where do vitamin D? Normally, you know, we go for a walk in the sun. We walk outside 10 o'clock in the morning or 4 or 5 o'clock in the evening. When the sun is out, you can feel a nice burn on your skin. You know, don't get sunburned, right? Okay, you don't want to have skin problems, but you want to have, you know, your skin making the vitamin D when you're exposed to sunlight. Okay. Unfortunately, for most of us, like me, right now, I'm sitting in a little enclosed room with the lights on, the artificial lights on. I'm not out in the open, and there's no sun stimulating my skin to make the vitamin D. Okay, so if you look in Singapore, there are a lot of people out there with deficiency in vitamin D, which we don't test for. You know, you're not going to go see a doctor. Nobody tests for your vitamin D levels. So it's important that you make sure you have enough vitamin D. If you're not in the sun, make sure you get it in your diet. Okay, if you're not getting enough in your diet, make sure you try and get some supplements for it. Now, a lot of multivitamins will look at vitamin D in terms of international units, what they call an IU. Okay, some of them have 50 IU of vitamin D, some of them have 100 IU or 200 IU of vitamin D. Okay, now, a lot of people, especially once you're older in your 50s and 60s, their recommendation actually is even to go up to 1,000 international units a day, and that's just for maintenance. If you're already deficient in vitamin D, you're going to need a much higher dose than that. Okay, so if you're already taking your vitamins, your multivites, look at the bottle. If it says vitamin D 200 IU, maybe it's not enough. Okay, but if you're adding 200 IU on top of your regular diet and your outdoor exercise, then that should be fine. Okay, but if you're not and you're largely office based, and then the vitamin D supplementation up to 1,000 units a day maybe something that you want to consider. And this doesn't just apply to older people, it applies to young people like me. I've got friends whose vitamin D levels are almost as flat as zero. The number is so small that even the blood test can't pick it up. Okay, so it's something that we see in Singapore. It's not looked at very much, but something you want to consider. Right. Too late. What's happened? What happens now? We've already injured ourselves. Okay. What we're going to talk about is things that you can do, okay, by yourself first. Okay, if you just sort of strain something, the pain is a bit there, you don't really have that much swelling yet, it's just a bit sore. One thing you can do is keep your leg up, rest, don't do too much. You can put some ointment and things like that, stuff that we normally use for your muscle aches and your strains. See whether it gets better after 1 or 2 days. If you don't stress it, your body oftentimes will let it improve. If it's a bit sore, starting to get a bit swollen, some people do resort to taking anti-inflammatory tablets. I mean, on the provision that you don't have any allergy to these. Okay. Now, if you have other symptoms, okay, then you may need to see a doctor. Okay. Other symptoms meaning swelling that's not going away, clicking in your knee, something keeps on clicking in your knee, it wasn't there, you twisted your knee and now it's clicking. Okay. Or if your knee jams up, you're walking and suddenly it just locks up and jams up and you can't move your knee anymore. Okay. Shake it and suddenly it unlocks and it starts moving again. Then all these symptoms or persistent pain that doesn't go away even after rest, these are things that you may that may make you decide, I think I need to see a doctor. Okay. Now, thankfully, with the relaxation of the circuit breaker going to phase 1 next week, I mean in June, we can see a lot more of these injuries. But prior to this, any sports related injuries, sports medicine related things were deemed as non-essential. And because of that, if you had mild injuries, most of us could only advise you to stay at home and to rest and to ice your joints. Okay. But if you're starting to injure yourself and the pain is not getting better and you're worried that something bad has happened, then contact your doctor. We'll have to actually screen through you to see whether or not you can be seen during this circuit breaker period. And then, if it's necessary, we'll have to actually assess the need to find out, did you actually damage something badly? Okay. Right. So the series of slides are basically going to show you what your doctor may do. I'm not saying that this is specific to any particular condition that you may get. Okay, these are things that doctors do in the clinic. Steroid injections are one thing that you may have heard of. It doesn't work for every condition and everybody. Sometimes the doctors or even the physiotherapists will do shockwave therapy. What that is like an ultrasound machine that delivers shock waves to the damaged tendons and ligaments and to try to stimulate more blood flow and a healing response to try to get it heal faster. Okay, so that's something else that is done. Injections, there are many forms of injections out there apart from painkillers, obviously. So things like platelet-rich plasma, and there are several new ones on the market which I won't go into. I mean, the idea here is you just want to get all the good healing factors from your body and try to stimulate your body to heal faster than it can or normally would. Okay, because mind you, as we grow older, the healing potential isn't as fast or as strong as it used to be when we were in our 20s or with teenagers. Okay, so we can do the same amount of exercise, get more damage, but we don't heal as fast. So the idea here with all these injections is to try to kickstart the healing response and try to get people to heal better. Now, always discuss all these kind of treatment options with your doctor, okay? Because not every condition or every patient is actually a good candidate for these procedures, okay? Some people go for gel injections for arthritis. It works for some. Usually for short terms, most patients, it will last up to 6 months maximum. It may buy you some time, but if you're expecting this to cure you once and for all, then I think you are a bit mistaken. So discuss this with your doctor. It's not entirely wrong. It is an option for a certain group of patients who need actually gel injections for their joints. Now, worst case scenario, you come to one of us, which is orthopedic surgeon. I mean, we are trained to fix up your body. If you've torn your meniscus, ligaments, torn something that won't heal by itself, then that's where we step in and we try to repair all these things so that we can restore you back to your original functional level. Okay, because I mean the name of the game is to try to get you back to where you were. I mean, the worst case scenario is, if something is not repairable or not amenable to even to surgery, is that you may have to change your lifestyle. Okay, but regardless, we don't want to reach this stage. Okay, ideally, remember, prevention is better than cure. Okay, so for example, this is a knee. That's actually the end of the thigh bone. So if you look at my knee joint here in my video feed, okay, that's the end of the thigh bone, the shin bone. That's the end. There's a curved bit of the bone down there. Okay, cartilage is white here. You can see this non-white beigeish colored area. That's pure bone. Okay, that's exposed bone. Why is the bone there? It's because the cartilage is gone. Okay, so this is just one example of where cartilage is missing. To try to repair cartilage which is actually a very, very difficult problem to manage. Okay, so we never want to get into this kind of situation. Okay, so remember, prevention is better than cure. Okay, because even surgery doesn't give you 100% results all the time. Okay, now if you torn a ligament, you may need some kind of repair or reconstruction, and oftentimes that comes with a long period of downtime in a brace or even physiotherapy. Okay, and definitely please don't fall over and break something. Okay, because we don't want to become the bionic man with metal implants everywhere inside our body. Okay, now I just want to mention this new thing that's making its rounds now. You may see it on the internet sometimes. You may see some doctors suggesting it. Now this new thing is called subchondroplasty. Basically, if you remember what I said just now about your bones not being able to handle the load, okay, if you jump and land, or if you've got existing arthritis, bring you. Okay, but you suddenly develop pain because the bone under the in the joint has cracked. It's not fractured and broken, but this is a crack. Now, in most people, the bone will heal. We just rest. We don't do exercises for too long. Don't walk too much. The bone will heal. Okay, that's the wonderful thing about our body. The bone will heal. But in some people where the healing rate is a bit slower, you know, or if there's some problem with the joint, you know, the shock absorber is broken so much so that even if you rest, you're still just walking around every day, is still putting more stress on the fractured part of the bone. You know, some of these fractures don't heal even after 3 months, 4 months, 6 months. Okay, so in those cases, you know, what happens is, if you look at the video again, this is a picture of a bone. Normal bone looks like that. Okay, and then you get this area where the bone is just all swollen because there's a crack there and everything is not happy. It's bruised down there. So what we normally do is we actually fill up that area with a calcium-based cement. Okay, and the idea there is to support so that it doesn't heave every time you step on it. It's much the same like this picture that I'm having on the slide here, where you have a crack in the concrete floor. You have a crack in the concrete floor and you put heavy things on it, it's going to heave and it's going to move, and that shifting is actually painful. Okay, so the idea of, if you've got a crack in a concrete floor, how do you fix that? You actually just reinforce it with more concrete. Okay, so likewise, what we're doing is we're stabilizing the bone. Once the bone is stable, the pain goes away. Okay, and it's a calcium-based cement that over time will remodel and become bone again. Okay, so it's not something that's permanently sitting in your bone as cement. It actually remodels back to bone again. Now, again, this is a good option for a very specific kind of problem. Not everybody will do very well with this procedure. Okay, and so you really need to discuss this with your doctor if you think you've got this problem, or if you've been told you have this problem. Okay, right. So come to the end here. I just want to remind you, these are my the three trained dark arts shoulder surgeons that we have. I'm Dr. Bernard, Dr. Ruben, and this is Dr. Roland. I do predominantly a lot of knee and hip work as well, because that was a large part of my training. We are part of the shoulder elbow orthopedic group, and we specialize in high level, highly specialized care for the shoulder. Okay. During this circuit breaker period, where a lot of people are trying to stay home and do a lot of social distancing, we do teleconsultations where appropriate. Okay, but in some cases where, you know, we think we actually really need to put our hands on your knee or your elbow or your shoulder, teleconsult may not be appropriate. But if you're not sure, you can always ask whether a teleconsult is something suitable during this period of time, or at least until the circuit breaker restrictions are lifted. Okay, we're based in 3 separate sites. I'm based in the Sports and Orthopedic. We've got a branch, shoulder elbow orthopedic clinic in Novena, as well as one in Farrer Park Hospital.